Here is an explanation for the normal radiological anatomy of the chest X-ray. So this is a PA view, a posterior anterior view of a normal chest X-ray. And let's start by explaining the mediastinum. So the mediastinum is the central compartment of the thoracic cavity, and if we draw its borders on the X-ray, it would be like that. So it would be on the center of the X-ray, as we can see, like that, and on this side also. And the mediastinum contains many different organs like the heart, the great vessels, trachea, esophagus, thymus, some nerves, and lymph nodes. It is better to explain it in this picture. So we have the heart in the central part of the thoracic cavity, and the heart is actually rotated horizontally and vertically. So it is rotated horizontally in this way, and vertically it is also rotated in that way, but it is just a little bit of rotation in both dimensions. That is why on the X-rays we have the right border of the heart as the right atrium. So the right atrium comprises the right border of the heart, and the left ventricle is the left border of the heart, while the right ventricle is located anteriorly and the left atrium is located posteriorly because of the rotation. And we also have the other mediastinal organs like the trachea, and posterior to the trachea we have the esophagus and the other organs. And on the X-rays we can also see the pulmonary vessels. So the pulmonary vessels branch to the upper and lower lobes of the lungs from the lung hilum. So on both lungs we have lung hilums that are about here on the X-rays. So this is the right lung hilum and this is the left one. And out of these hilums we have the pulmonary vessels, the arteries and veins coming to supply the lung lobes. So on the right side we can see multiple vessels like here, here, and here. We can also see multiple vessels here, 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 and so on. So the upper lobes vessels are smaller in diameter than the lower lobes vessels on the erect chest X-rays. So if we split the lung in half like that, and if we look closely to the upper lobes vessels, we can see that they are less prominent than the lower lobes vessels. So if we compare the upper lobes vessels and the lower lobes vessels, we can see that the upper lobes vessels are much less prominent than the lower lobes vessels. And in pulmonary hypertension, the opposite happens. So the upper lobes vessels become more prominent than the lower lobes vessels. Now let's explain the locations of some structures. So starting with the trachea, so this is the borders of the trachea. As you can see here are the borders of the trachea. So this is the trachea coming down like that. And the trachea is normally a little bit deviated to the right, and that is normal. But if it is deviated more than that, then it is tracheal deviation. Now we also have the aortic arch is also clear on the chest X-rays. So this is here the aortic arch. It is very obvious on the X-ray. And we can also see the descending aorta. So from the aortic arch comes the descending aorta, and this is its border, like you can see here. So in zoomed in picture, this is the border of the descending aorta. So it comes like that. We can also see the border of the superior vena cava, like that. So this is the border of the superior vena cava. And this is it in a zoomed in picture. So this is the border of the superior vena cava. We can also see the border of the left ventricle. So on the left side, we have the border of the left ventricle, and on the right side, we have the border of the right atrium. So this is the border of the right atrium. We can also see the right hemidiaphragm. So this is the right hemidiaphragm, and this is the left hemidiaphragm. We can also see the clavicle on the x-rays. So this is the clavicle, this is the right one here, and this is the left clavicle. We can also see the posterior and anterior parts of the ribs. So let's take this rib for example. So this is the posterior part of this rib. So it comes like that, and it goes anteriorly like that. So this is the anterior parts of the rib. And we can also see the left and right lung hilum. So it is about here, the right hilum, and the left hilum is here. And we can also see the lung apex. So this is the lung apex, the right one and the left one. Now let's talk a little bit about the lung anatomy. So on the right lung, we have 3 lobes, and on the left lung, we have 2 lobes. So the right lung, we have the upper and middle lobes, and we also have a lower lobe. So there is the horizontal fissure separating the upper and middle lobes of the right lung. And we also have the oblique fissure separating the middle and lower lobes of the right lung. And on the left lung, we have only 2 lobes. We have the upper lobe and the lower lobe. And there is the oblique fissure separating them. So this is here the oblique fissure. And this is if we look at them from an anterior view. If we view them laterally, we can see that this is the oblique fissure on the left lung. By the way, this is the posterior part of the left lung, and this is the anterior part. And on the right lung, this is the anterior part. So this is the anterior part of the left and right, and this is here the posterior part. So on the right lung, we can see the oblique fissure here and the horizontal fissure here. So if we look at the lungs from the anterior view, we can see that the upper lobe is taking a lot of space, and the lower lobe on the left lung is taking a little bit of space. It's also taking a little bit of space on the right lung too. And the middle lobe is taking more space than the lower lobe does on the right lung. But posteriorly, we can see that they are pretty similar. We have the upper lobe taking a little bit of space, while the lower lobe is taking a lot of space. And the right lung also, the upper lobe is taking a little bit of space, while the lower lobe is taking a lot of space. And this is very important to understand, so you can understand the silhouette sign easily. Now let's explain the lung anatomy on the chest x-rays. So the left picture here is for the anterior parts of the lungs, and the right picture here is for the posterior parts. So anteriorly, on the right lung, we have 3 lobes: the upper lobe, the middle lobe, and the lower lobe. And anteriorly, on the left lung, we have 2 lobes. We have the upper lobe and we have the lower lobe. Now, the middle lobe of the right lung is hugging the right heart border. So, middle lobe of the right lung is hugging the right heart border, and the upper lobe of the left lung is hugging the left heart border. So, they are in close contact, the upper lobe of the left lung and the left heart border, and the middle lobe of the right lung and the right heart border. Now, regarding the posterior parts of the lungs, we have two lobes on each side. So, on the right side, we have the upper and lower, and same goes for the left side. So, upper and lower. Now, you can see that on the posterior parts of the lungs, the lower lobes are actually, they have more space. So they are posterior to the heart. So there is a lot of lung posterior to the heart and also posterior to the diaphragm. So on each side, we have lung tissue posterior to the heart and posterior to the diaphragm. Now, if there is a pathology that happened to be in the middle lobe of the right lung, close to the heart border, or on the upper lobe of the left lung, but also close to the left heart border, the pathology would obstruct the heart border. We can't see the heart border anymore because those lobes are in close contact with the heart. So if there is a pathology in them, the heart border would get obstructed. While if there is a pathology on the lower lobes of the lungs, meaning it is on the posterior parts of the lungs, and even if it was right here, let's say, posterior to the heart, then it would not obstruct the heart border. And that is what we call the silhouette sign. Now also, as you can see, on the anterior parts of the lungs, I didn't cover the apex of the lungs. So the apex of the lungs, it is not covered on the anterior part because the apex of the lungs are more posterior. So they are covered in the posterior parts of the lungs. That is because the apex of the lungs are located more posteriorly. So as you can see, this is the apex of the lung. On each side, it is more to the posterior. Now also you can see that the posterior parts of the lungs are extending beyond the diaphragm even. That is because the diaphragm is not flat. It is actually curved. So there is a lung tissue behind the diaphragm. So all this area behind the diaphragm, there is a lung tissue on the posterior parts of the lungs. So that is why I include it here, just for you so you understand. And with that, we reach the end of this video. It is valuable to mention that this lecture is a part of a bigger collection of lectures. It is called the Chest X-Ray Masterclass. You can check it out if you want. There is a lot of valuable information there.